Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Now, this is a question that always comes up, is when to start anticoagulation after ischemic stroke in a patient with atrial fibrillation. In this study, there's an early and a later period starting at DOAC at 3.1 days versus 8.3 days. Now, before starting at DOAC, 22% had IV thrombolysis and 7% won thrombonectomy. The primary outcome was recurrent ischemic stroke, symptomatic brain hemorrhage, unclassified stroke, and systemic embolism within 90 days. So this enrolled 3,621 patients, mean age 79 years old, with an ischemic stroke and atrial fibrillation. And one group, here we just did less than 4 days after stroke onset, and the other was in between 7 to 14 days. And the clinicians can start any DOAC medication. And at admission, 41% NIH stroke scale at 0 to 4, 34 had 5 to 10, and 25 had a score greater than 10. And that's NIH stroke scale. And the outcomes didn't differ at all. And it didn't matter what prior anticoagulation was used. So it appears starting DOACs within 4 days appears to be safe. Now, the timing decision for each patient needs to be individualized, of course, based on the patient's age, comorbidities, and brain image finding. But this gives us a start, and when we can review starting anticoagulation after ischemic stroke with atrial fibrillation.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.